It was a particular Sunday morning. I was driving to church and I started feeling pain in my belly and lower abdomen. In retrospect, I can now say that that was where the journey started. I didn't tell my mom, I didn't tell my siblings, and because many friends, family members have had cases where people didn't survive it. So when you mention cancer to them, they're like, oh, is he going to die?
So we started with systemic therapy. He had 6 cycles of that therapy. Then he came for radiotherapy. This was to reduce long-term complication. He's been coming for regular checkup and everything has been fine. Cancer has been a big burden in Nigeria because most of our patients present late, and in the past we had no functional cancer centers. Breast cancer seems to be the most common, and the same with about 35% of our cancers are breast cancer. Prostate cancer and cervical cancer are also high on the list.
We started this center with 95% patients palliative, and it took us 3 years to be able to go even, to say 50% curative, 50% palliative. And now the shift is towards the right, which is more, we're seeing more patients coming in stage 1, stage 2, and because they're coming in at those early stages, and then we can actually achieve cure.
Japa syndrome is a Nigerian needs for brain drain, basically. You've had a lot of healthcare workers leave to the US, to the UK. Being able to do all the things that if you were to go to the UK and the US, you read in the textbook, you know, when you go for a conference or you attend a webinar, you're able to see all those things and you can actually do them for your patients. And that's the environment that we've created here. And we are slowly beginning to see reverse medical tourism.
In the last 1 year, one of the biggest achievements of this center is that we have been able to train 8 other centers to achieve a very high standard of training.
One of the things we're committed to is patient education, and we do that very aggressively through our social media handles. And over the past 5 years, collectively, we've treated over 14,000 patients. You don't need to travel so far to be able to get treatment.
We started this center with 6 oncologists. Today there are 10 oncologists. This is the largest center in the whole of West Africa. Talent retention, patient services, and being able to bridge the gap or the barrier of medical tourism. Those for us are what the impacts are about. Much less about the financial returns, and then but the number of patients.
And from this first center, we're now looking at expanding access to care across Nigeria. And we're looking to expand beyond just the treatment element with radiotherapy, because treatment doesn't happen before diagnostics.
We want to be at the forefront of leading and spearheading that transformation when it comes to cancer care. We aim to provide the best standard of care, harnessing technology, skill, and research.
I'm also proud to say I'm a testament that you can get good healthcare treatment in Nigeria and also recover well. I'm planning to write a book about all of that experience and documenting them. If people get diagnosed early enough and speak with the experts, there's hope.